Today, we're tackling incontinence and sharing practical restroom tips to help caregivers feel more confident and prepared. So stay tuned and we'll get into it. Hi, Dr. Lakeland here. Welcome to Caregiver Chats. I'm a gerontologist and caregiving advocate for Home Instead, an Honor company. I'm so glad you're taking the time to join me. These conversations are a space for learning, reflection, and support. And I invite you to subscribe to Caregiver Chats on Apple, Spotify, or wherever you get your podcasts. And don't forget, I love hearing from you. You can email me anytime at caregiverchats@homeinsteadinc.com. In this episode, we're talking about a topic that's often uncomfortable to bring up, but incredibly important for family caregivers to understand: incontinence and restroom care. Whether you're supporting a loved one with mobility challenges, dementia, or age-related changes, helping them maintain dignity in the bathroom can be one of the most personal and stressful parts of caregiving. To help navigate this sensitive subject, I'm joined by Seni and Christina Hardin-Weiss, co-founders of Adaptive Equipment and Caregiving Corner. As experienced professionals in physical therapy and speech-language therapy, they bring a wealth of practical knowledge to helping caregivers feel more confident and prepared. We'll be covering common causes of incontinence, helpful products that can make a big difference, and everyday tips that can improve safety and comfort in the bathroom. If you've ever felt overwhelmed by this part of care, this episode is for you. Hi, Seni and Christina. Welcome. Thank you so much for joining me today.
Hello. Thanks for having us, Lakeland. We appreciate it. It's good to see you again.
It's great to see you both. I love following your work and all that you do. Your videos, so informative and practical. And so that's why I'm so excited to have you both with me today to talk about this topic, which many people shy away from or maybe are embarrassed to talk about. We're going to be going over incontinence and restroom tips, but that is something caregivers are helping with on a daily basis, often multiple times a day. So I hope that listeners find this to be a really helpful and practical conversation. But before we dive in, I would love for you both to allow our listeners to get to know you a little, share a little bit about your backgrounds and the wonderful business that you have.
Awesome.
Thank you. Yeah, my name is Seni, and I am a physical therapist. I have been practicing for about 32 years now. The majority of my time has been spent in the home health realm. So I enjoy, really visiting people in their homes. That's kind of their space, and it really gets to know the people and understand what needs they have.
And I'm Christina. I'm a speech language pathologist. I have been practicing for probably about 24 years. My specialty is long-term care. I worked in long-term care most of my career. And I really enjoyed working with people that were living with dementia and their family caregivers. I learned a lot. And it was a lot of fun.
Yeah.
We are Adaptive Equipment and Caregiving Corner. So like Lakeland said, we make videos to show people how to use adaptive equipment safely, because Lakeland, as you know, you could get this equipment online just about anywhere, but just because you can buy it online doesn't mean you know how to use it safely.
Exactly.
So that's where we feel like our videos come in. And not only that, but to help raise awareness that those products are out there. Being in home health, we have also seen that it's, what the right tool can do for the right situation of the right person. So it can really be a game changer. So that's what we do. So we make those videos and put them out there on our YouTube channel. And we would invite anybody to check out our YouTube channel if they're curious about pieces of equipment or how to give physical care.
Mm-hmm. Yes. Oh gosh, you have so many wonderful videos on your YouTube channel. And I also love your website because you have so many helpful resources like the lending closet directory, because some people might not realize some of this equipment you can get gently used or secondhand. And so you have a place where you can go and kind of search by state to see, is there a local lending closet near me? Because as you said, you could find all of this online, but if you can find it used or gently used, even better for cost-saving purposes. So,
absolutely.
And I think that, family caregivers, sometimes they don't even know what could be helpful. As you mentioned, Christina, these little things can make such a big difference in a daily routine. And if it can help, shorten the routine or make it more efficient or effective, gosh, that can go such a long way in kind of just making the overall care journey a little bit easier or more manageable.
Yeah,
right.
we get calls, Lakeland, from people that they've got to go pick up their parent, maybe their aging parent from the hospital or a nursing home, and they just don't know what equipment they will need in the home. And so, besides caregiving being hard on a body, it's also hard on a wallet, because if you don't know what kind of equipment that your loved one might need, you might go out and purchase it, and it might be something that they don't need. So now you're stuck with this, that, or the other, and some of the equipment you just can't return for hygiene purposes. So, if there's anything we can do to help narrow that down, or at least go to a lending closet and say, I think this is what I need. Is this such an animal kind of thing? That would help financially, I believe.
Absolutely. Well, as we kind of delve into this topic, maybe we can kind of just start with the basics and talking about incontinence and what it is, and maybe some of the common causes, and maybe some of the things that you both see kind of from a professional perspective as something that is kind of a common occurrence amongst older adults as they age, or common challenges that caregivers deal with on this topic.
Yeah.
Right. Incontinence, again, we all know it's something that people don't like to talk about, but it can affect a lot of people. Yeah. It can be, you can have a variety of different types of incontinence. You can have stress incontinence. A lot of times you hear the gals say, if I wet my pants a little bit when I sneeze, or if I cough or something like that. That's, you put some pressure on the bladder and you have a little stress incontinence. Or you may have, there's something called overflow incontinence, where you actually are not able to fully empty your bladder. So you may leak a little bit from that. You also might have urgency, and, you're constantly feeling this urge to have to urinate. Yeah. There's a lot of different things that can go on. And we always like to try to get down to at least having them see their physician to try to find out what's the source of it. Yeah,
that's important.
Because if you don't know what the source of it is, you might be able to, fix something or do something that might help you kind of stave off that and not get into that whole cycle of having to use a lot of incontinence products and things like that.
And as far as therapy is concerned, there are therapies. There are, lots of times PTs or OTs will have specialize in pelvic floor health. Right. And so there might be some exercises or something that they could prescribe to you to help that. If it doesn't necessarily have to be a part of aging. Right. And confidence doesn't have to be a part of aging.
But we all have to realize, as we age, of course, our muscles weaken. Yeah. And pelvic floor is no different.
That's right.
That is full of muscles. And that's what kind of supports the bladder. And, if that weakens, there can be some incontinence there. So therapy may be beneficial if that's the issue that's going on. But again, getting down to what is the underlying issue is very beneficial.
And getting to your primary care and finding out what that root cause is. If your primary care doctor doesn't know that it's an issue for you, they don't know how to help you. And there might be something they can do to help you, but you need to let them know first and foremost before you go anywhere.
Absolutely. And I think sometimes people do make that assumption of, it's just part of getting older, just something I'm going to have to deal with. But to your point, likely not. There's something that can be done about it, or at the very least, make sure that your physician knows so that they could address it from maybe a medication standpoint or just a therapy standpoint. Or if it is going to be an ongoing issue, something that you can get ahead of, get on top of, and find the right products that are going to best support you throughout your kind of day-to-day life. And I did also want to cover the topic of UTIs, because infections, urinary tract infections, they can cause a whole host of issues. But it is something that we commonly see in the older adult population. So maybe we could just spend a little time talking about the kind of what UTIs are and maybe ways to prevent it and those kinds of things.
Yeah. So as far as the urinary tract infection, I know being in long-term care, that was one of the first things whenever somebody, maybe a behavior was different, or it might present itself as like a stroke. The person you think they're having a stroke. They've got weakness on one side. You might have a little bit of delusion. And so I think your first step would be, or our first step was to let's first check for a urinary tract infection, because I feel like what will happen is as we do get older, we stop drinking as much water. Or if we have had incontinence episodes in the past, we will self-limit our intake on fluids because we know we're going to have an incontinence episode, So, but by not drinking, it gets to be this cyclical thing. By not drinking enough fluids and flushing out your system, that would increase your risk for getting a UTI, but then so all the more reason why you need to go see your doctor, because if there is some kind of an incontinence thing and you're trying to self-regulate your fluid intake, that's just going to compound it by, if you have a urinary tract infection, it could come out looking, like you've had a stroke, like you have some kind of early onset dementia or some kind of mild cognitive impairment. It's still an infection, right?
Right.
And so, addressing it with your doctor and getting on that, because there are medications that you could take, and boy, we have seen in my practice, I've seen like a night and day difference when you figure out that that person has a UTI. They can be lethargic. Everything. And then we find out that they have a UTI and you get them on some medication, and it is night and day with their cognitive, faculties.
And some of the other things, to look for, to see as going along with that, like cloudy urine, the urine smell is increased. They may have frequency increase. They're going to the bathroom much more frequently.
And not as much output.
That's right.
They get that sense of urgency a lot more.
Yeah. So a lot of different things can contribute to that, and it certainly can affect the cognition. So that is something to definitely look for.
Yeah. And so at the first sign, hop on it, especially if maybe your loved one might have kind of a predisposition for UTIs, if you can hop on it that first time and figure it out with your primary care physician, what's going on, then you know what those signs are to look for. And then it gets a little bit easier to treat in the future, as far as, making sure that they get fluid. And if we need to increase their fluid to decrease the risk of UTI, then we need to get them on a toileting schedule, so just like you would anybody that you're teaching how to toilet, you're just kind of teaching them. There's just another component in it that, you're teaching them how to toilet again, only every 2 hours, and checking to make sure that even if you don't have to go, you need to go again, try. So something like that, I think would be helpful for caregivers.
Yeah.
That's such great overview and tips and intervening at those first signs. And I share with families a lot, or if they tell me, gosh, it seems like overnight mom's dementia has worsened, I say, well, go check for a UTI, because that could be, the source. And it is quite amazing to me just how much a UTI can impact a person. And so I'm glad that we've covered that topic and encouraged caregivers to stay on top of that. And then as they kind of maybe navigate incontinence, there's a number of products out there. I think the most well known is adult briefs, like Depends. We see those commercials on TV, but what is so neat is that there has been a lot of new products that have come onto the market that maybe aren't, getting the fancy TV ads. So we might not know about them. So I am really looking forward to hearing from the both of you. What are some of kind of the new products out there? And maybe, of course, covering, adult briefs and pads, those kinds of things too, because we know that those all, of course, are still a very helpful set of products for incontinence.
Right. Let's address the adult incontinence products first, and then because I think that tends to be people's first go-to is to go to the store and get some adult briefs, and then maybe come back and start on some of the products and stuff. So
the big thing is. And I'll tell you, I've told you how long I've been a therapist, over 30 years. And And we really didn't, we were approached by a company. The company's name is Seni. They're an incontinence product. And we didn't really dive into incontinence products because we could review 100 different ones. But when we got to know this company, we really became a little bit more educated.
Absolutely.
And it was surprising.
Yeah.
It was surprising
100%.
because, you know, when you just think about, oh, I got to go get a brief or I've got to go do this and then I'll be fine. And we go to the store and we look at the most absorbent. Okay, this is going to hold, you know, how many ounces? That's the most absorbent. I'm going to get that one because that's going to take care of all my problems. Yeah. And, you know, that doesn't do it. The problem with incontinence products a lot of times is people aren't educated enough on them, knowing that you really need to know what absorbency do you need. If you are just a light urinator during the day, you don't need the thickest, you know, brief or pad out there. It's just going to inhibit your function, and it's going to, you know, kind of, you know, the dignity aspect as well. So you need to know your absorbency. You need to know your size, and then you need to know the style that you would work best for you. If it doesn't fit correctly, it's not going to do its job.
Right. That's a big factor.
That's exactly right. And you know, Lakeland, one of the things that we kind of realize too is, you know, you always think, oh, if you're wearing an incontinence pad and you urinate in it, let's get that off real quick. If the incontinence product is made well and designed how it's supposed to work, you should not have to change it immediately. It should have the capability of absorbing that urine or wicking that urine away from the body and holding it in some form that is going to stay away from the body. And the main thing I'm talking about is overnight. Because, you know, sleep is a huge thing for people. You've got to get a good night's sleep. And if we're thinking, that's right, the caregiver
and the care recipient.
Yes, absolutely.
And, you know, a lot of times we have caregivers that they are so good and they're like, oh, I get up every hour or every 2 hours and I change them and I make sure they're dry. If the incontinence product is correct, it should hold overnight. It should keep them dry. It should wick that urine away from their skin and keep that okay and hold overnight. And that's something that we really, it was just kind of like a smack upside the head. But yeah, so you have to have the right product. You have to have the right size, the right style, the right absorbency. And that's what we liked about the company Seni is they are huge educators as far as that for caregivers.
And they have some really within the incontinence products itself, they have some really interesting technology too. Yeah. I mean, it might seem small, and you might not even qualify it as technology, but they have, you know, some incontinence products will have like a strip that goes down the outside of it, and it will turn a color, and that way you will know, the caregiver will know that that it is wet, that the incontinence product is wet. You know, that's amazing. And then on the inside of this, and if you have children, infants that you change children's diapers on, this probably technology is not new to you, but there's also a little
it's this little band right here.
Yeah, it's like a little elastic band on the inside that helps bring it closer to the leg.
Yeah,
that helps keep any kind of spilling out over the side, and it allows the wicking urine to stay away from the body and stuff.
It also, you know, it's got to be breathable. It's got, and that's going to help. You know, you've got to have some breathability so that the humidity from the urine is not right there next to the skin. The other thing that we learned, which was really interesting, is, you know, these things come packaged. They're all wadded up and squished in. And what we learned is you really need to take them out of the package and kind of ruffle them up. Because that's
I would have never thought of that.
Yes. It's like an activating.
That's right. That's going to help loosen everything up, and it's going to help improve the fit of the product.
It's like buying a shirt. Like when men's shirts, they come packaged in a little cellophane and they've got pins. You wouldn't just put it on there. So you take everything apart and you kind of flip it around, and then they would put it on and stuff. So, and in the incontinence product is no different.
Yeah. Yeah. You know, and then for the caregivers and the care recipient, you really need to decide, you know, where are you having to change them? If it's someone that's dependent, You may want to look at the tabbed. It's some
Briefs,
of them, they call them different, briefs or but some of them have tabs that may be more effective if someone isn't bedbound. The briefs, the ones that just kind of slide on and pull
like a
up.
pull up, yeah.
Those are better for if they're a little bit more active and up out of the bed and able
Out
to
in the
move
community,
around. So there's a lot of different things to really consider instead of just trying to go and grab the most absorbent. That can really help the individual as well as the caregiver as far as, again, the physical aspect of changing, the dignity aspect, the independence aspect. So it's it's surprising how much consideration it really is.
Yeah. Well, and it sounds too like you might need a different product during the day versus overnight as well.
Absolutely.
And instead of just having one all day long. So you might need one overnight that's more absorbent so that everyone can get a better night's sleep.
That's right.
And then one during the day that maybe is a little lighter or just has a little bit of different functionality to it. And I think that it's so great to see innovation happening in this space to help with the caregiver to make it more dignified, because we know, again, this can be a sensitive area, especially for us who have been able to take care of this within our own personal care routines for our lifetime, and then to need a little more help and support. I think that's why we shy away from this topic. And so I'm grateful to hear that there are new products that are coming out. And I love the innovation of the color changing. And I was talking with Carrie Alber's Dementia Darling recently, and she was saying that some even have like a sensor that can connect to your smartphone and tell you just how full the brief is. Wow, that would be a game changer, I would imagine, for caregivers, so that they, in the middle of the night, can just wake up, check that and think, oh, I can go back to sleep.
And the peace of mind, absolutely. Yeah. Like when it is such a sensitive topic at Adaptive Equipment and Caregiving Corner, we try all of our products, including the incontinence products. So when we first started working with Seni, they sent us some samples, and that's another thing too. Besides education, they will send you free trial samples, so that you can try them out. So, so Cindy had tried a pair on. You tried some overnight, and then you put some on. And we went to the grocery store, and so she had some out in the community. And
it was eye opening.
Yeah,
you never, if you're not incontinent, if you've never experienced that. But you have a loved one that has or does, you really ought to try that.
Put yourself in their shoes.
You ought to put yourself in their shoes, because, the concern, the fear of, am I leaking? Am I showing? Am I going to
Is there
wet
an
the
odor?
bed? Yeah, is there an odor? All of those things are, it's top of mind.
Yeah. And can you imagine? I mean, that was as a non-incontinent person.
Right. That's right.
Somebody that is incontinent, and maybe if we had a little bit of a cognitive issue thrown in on top of that.
Right.
And they're unable to tell you that that's their concern.
Yeah.
And that comes out as a behavior. I mean, man, it's just, it can be, I think, the right product for the right situation. It can really be a game changer for everybody concerned.
Well, and for the concerns that you just mentioned, sometimes we see individuals start to withdraw from social situations and become more isolated because of those fears. And so that's the last thing we want, because we already know that there's increased risk of isolation as we get older. And so, being able to continue out in the community and to feel comfortable with whatever incontinence products you're using, I think that can just be a confidence booster and just continue to foster that ability to get out and socialize, which we know is so important, so key.
Yes, absolutely. So some of the products then, we don't have this, but we've had several people talk about, for their female loved ones, the PureWick Incontinence. Have you
I've heard of that. I haven't.
It can be a real game changer for a lot of caregivers, so we don't have them, but the downside to them is, and this might be getting better, is that it can be kind of expensive.
Yeah.
So, but that for women overnight, that PureWick can really be a game changer, a dignity saver, and even, helping with functional independence with incontinence.
And I'll tell you, like when we just recently reviewed a product, if it's okay to step into that realm a minute.
Yeah, please.
We just recently reviewed this product. This product was made by a physical therapist. This is called the Potty Cap. And this is a female urinal. And basically what you do with this, so here's the supply jug, basically. You slide this portion underneath your bottom or underneath your peri area, and then you scoot forward. So it kind of goes in forward like this, and then you lean forward just a little bit, and you urinate right into this.
So it's got like a little built-in trough here.
It's got a little trough.
And a little ramp. And so the gravity pulls it down into the reservoir.
So the interesting thing I like about this is that, if you're female, we always have difficulty with this. Getting up at night is a huge fall risk, especially if you have urgency, you got to go frequently. And having an option to be able to sit on the side of the bed and use something very easily. I really, really like this product. It's called, like I said, it's called Potty Cap, but we trialed it out, really like it, really think it's going to be a game changer for women. There are female urinals out there, but a lot of them trying to position them, trying to hold them, trying to figure out, how, trying to hold them close enough to catch what you need to catch. This really was interesting seeing that.
And not only at night, but this could be something during the day. Yeah. Or during travel, take it with you during travel and stuff. It could actually be used, while you're sitting on a chair. If you're a camper, if you go camping.
Yeah.
I mean, good for, even if you didn't have incontinence issues, right?
Yes.
Problem solved for women. No more squatting out in the field.
Oh man, I'm not a camper, but that would maybe make me consider camping now.
That's right.
But I think that's so great because handheld urinals for males have been available for quite some time, and just the mechanics of it all for women have just made it a little more challenging. So we'll be sure to link to that and all the products that you've mentioned or will mention in the show notes that folks can go check it out. But I'm glad to see, again, the innovation and to see a physical therapist create a product, that they're thinking about it with function in mind.
Yeah, sure.
Absolutely. Yeah, I mean, you can't, as a therapist, that's one of the things that you can't get very far in your therapy treatment of the day,
right?
Unless that person is dry and is able to participate fully in your treatment. So physical therapists, even speech therapy, we're always thinking about that because you need their full participation, and it's not something that they can give you if they're worried about incontinence. So
yeah, absolutely.
What's the next one you want to show, Sen?
These are more. These are just kind of, a lot of people are reaching out to us for assistance for wiping themselves, cleaning themselves. Hygiene. People use these for different things. There are so many different things out there. And what we've found with people responding to some of the stuff we've shown, it's kind of hit and miss, and I hate to say that. There's just not one that works for everybody. We have some that people are like, oh my gosh, this is the best thing ever. And then we might have somebody turn around and say, no, it didn't work for me. So, unfortunately, because these are hygiene products, you can't return them, which makes it very sad. But if there is difficulty reaching, one of the things that I say, try to start with initially, because it's probably the least expensive, is long-handled tongs. And
okay. I would have never thought of that.
And you can, these are plastic coated here on the end.
They're made for
personal
hygiene.
Yes.
Yeah.
Okay. And you can just take your toilet paper. I don't even know where I put that toilet paper. Oh, here it is. But you can just take your toilet paper and attach it to the tong here, and then just wrap it around. And then, do your cleaning, and then just kind of let it go in the toilet when you're finished. There's, again, all kinds of products out there. It's difficult to know what's going to work for different people. There are also products for just cleaning. This is one that I don't know. We got, and it just looks a little aggressive. I don't know.
Yeah, it does.
But, for some people, they're like, oh, yeah, this is wonderful. This is wonderful.
Yeah.
There is one thing that I want to mention, and I know people hear this all the time, but we always like to reiterate it. When you are toileting, you always, as females, you need to wipe from front to back. That is another thing that you really want to be careful of.
Especially with UTIs.
Yeah. You just want to try to keep the area as clean as possible. And
but a lot of these products, like Cindy said, and not even just with the hygiene products or the toileting products, we get a lot of people that will say, well, that won't work for me. Well, you know what? Every product isn't for everybody, but isn't it awesome that people have options? That's what we're here for, is to raise people's awareness that these products are out there. It might not be for you, but it might be like, for example, this one's called, that we showed first, is called a Bottom Buddy. And we talked to a woman that she's like, I always have a spare and a pair around because it's something that she finds helpful. Yeah. Well, we get another comment right after hers. It's like, I don't like this one, but but at least this woman, it was an option for her and it worked for her. And, it's just nice to have options.
Yes, absolutely.
Well, and of course, too, if it can help somebody continue to be independent in this activity of daily living for a little bit longer, for many, it's so worthwhile. And to maybe try a couple different until you find one that does work well for you. And I know, even through my career at Home Instead, back when I first started, had to be a care pro from time to time. And I just remember apologizing to the clients that I worked with because I was brand new. I was very green in this field and helping with this activity. I think it does take a little time to get comfortable with the person that you're working with, to kind of get in a good routine, what works, what's comfortable for you, what's comfortable for them. So I think caregivers also need to give themselves a little grace. This is something that might take a little trial and error. And if it's something that you're really not comfortable with, looking into something like home care might be a good option to come in and help support. If it's just something that, you're not willing or able to handle, or just want a little extra support and guidance on, that can be an option. In addition, of course, to reaching out to an occupational therapist, physical therapist, and getting those supports. So I think it's also helpful for caregivers to know you don't have to be in this alone. There's a lot of resources you can tap into around this topic. And I know I jumped in. So if there was any other products you wanted to cover.
I wanted to touch on this too. Lynn, you're right. Because toileting, using the restroom, you've been doing it your whole life, right? Since you're about 2, maybe. And it's very personal. And so getting to know the person, the care recipient, your loved one that you're helping in that area is so important. I went to a conference one time and sat in on an occupational therapist was talking about working with loved ones that had dementia. And he took a roll of toilet paper and he passed it around and said, everybody just tear off a piece of toilet paper. We're going to talk about it later. And he passed it around to everybody. Some people just took all kinds, some people took a couple of squares and stuff. But he said, now I want you to notice how much you took off versus your neighbor, because that's how personal toileting can be. Some people might use a lot, and maybe some people grew up when, this material was scarce and you had to use only a couple of squares, so everybody's different. So it's important to get to know what your care recipient, what they need during this really personal event or happening in their life. So that's, I think that's something that everybody needs to probably.
Yeah. And one other thing is we kind of, I think we think, we think more about women with incontinence, but, men have incontinence also.
That's right.
And I don't have it with me right now, but there is an awesome incontinence product, especially for wheelchair or bedbound individuals, gentlemen. It's called QuickChange Wrap. And it is basically, you'll have to take a look at it. I'm sorry, I don't have it with me, but it's basically kind of a U-shaped item, or a half circle item, and it will wrap around the penis. It will hold 16 ounces, and you basically wrap it around, close the top of it, and it is something that would allow the hopefully allow the individual to change themselves.
Yeah. They could put that on and then put a brief on over it so that it holds it up against their body. And then when they're out in the community, they don't have to change this whole thing. They could just change the QuickChange wrap, which would make more, provide dignity and then also functional independence out in the community. Another product that isn't directly, but kind of indirectly is our pants, like the CareZips pants from Joe and Bella.
Yes.
They have really nice zips down the side that really allow the person or the caregiver to get and help with any kind of incontinence or even just hygiene. And then they also have a zipper that runs from the inside knee through the crotch down to the other knee. And so that gives them access. Maybe they might have a catheter or, something like that. And that would give them access to that. And that's called CareZips pants from Joe and Bella. That, I think, we have a video for those. Lakeland and Roy saying, we got a video for that. We got a video for that.
Yes, check out their YouTube page.
So if you go under our YouTube channel, look up CareZips pants. We do a demonstration of those CareZips pants. And I think those pants could be a real game changer. They got some nice elastic waistband, but I think they're really stylish looking.
Yeah.
They aren't something
they are
that
kind
you
of
would,
like a exercise pant.
Yeah.
Yeah. Yeah,
So,
very cool.
I've checked out their website. It's like kind of a Lululemon vibe. So very trendy and it looks very comfortable. But I think you bring up a point we haven't really talked about is the clothing, that makes going to the restroom. I mean, if you have a belt and then a button and then a zipper and you have frequent urination, getting into the bathroom, getting onto the toilet just will take longer. So maybe also just reevaluate the type of clothing that your loved one is wearing. If it's just around the home, the elastic waistbands, much easier. If they've always worn a belt, it might be hard to kind of break them of that, but just kind of, talking through the ease of getting on and off the clothing could help with some of these incontinence issues or those frequent trips to the restroom.
Yeah,
that's absolutely
true. And there's all kinds of stuff out there, Lakeland. If people can't find it, have them come to us and reach out to us, and we'll be happy to do some research on it. But I know they make a belt that is easy on, easy off. And you're probably too young for this, but when I was little, they used to have magnetic buckles. So it had a magnet that would just clip, the buckle would clip, but it looked like a buckle, but it just had the magnet in the back. I mean, even something that simple will still give them that dignity that they're used to with the wearing a belt, but it make it a little bit easier access during toileting and stuff. So but there's all kinds of stuff out there. People are so smart, Lakeland. And it's usually because there's a necessity, and it's usually a caregiver that comes up with these products because they've had to. So, do some research. There's lots of resources. Reach out to us. If you're like, is this such a thing? Reach out to us. We'd be happy to. If we haven't run across it yet, we would certainly do some research and see what we can find.
Absolutely. You both are such a valuable resource to caregivers. And before we wrap up, I know we've mentioned it a few times, dementia, cognitive decline. I think that in caregiving scenarios where there is cognitive decline, Alzheimer's, dementia, other types of dementias, that can just add a little bit of an additional layer of complexity, especially as it relates to restroom use and incontinence. So any kind of thoughts for those caregivers that might be, struggling with, I could list off a whole host of issues that could come up, but would love to just spend a little time there if we could. Yeah.
I feel like with routine, and the every 2 hours, even if you don't have to, getting your loved one that's living with dementia, getting them into that routine of going to the restroom. Maybe they've stopped drinking because on some level they know that they will have to use the restroom. That's when the jelly drops, the hydration jelly drops will come in, where they're getting hydration and those electrolytes and stuff. But again, you need to coincide that with the toileting schedule and every couple hours going, and if you ask them and they don't have to go at that time, wait a few minutes. It doesn't have to be at the top of the hour or the quarter past the hour or whatever. Ask them if you can't get them and redirect them, then give them a couple of minutes and ask them again if they want, if they want to go. If there's something where you could say, hey, you know what? I need to run into the restroom and the bathroom, and I got to do something here in the bathroom. Why don't you come in there with me? Maybe you could go to the restroom, while I'm doing this or something. And then maybe step out once you help them to give them their dignity or whatever. So, I mean, it's just really, it's really, the scheduling I think is important, but not to the second. We need to still be a little bit flexible with the schedule, but I really think that redundancy and that making sure that getting into the habit of it is really going to be beneficial to the loved one, because now we're doing it every 2 hours,
right? And
we're going to help cut down on that UTI risk too, right? So, and then we're getting them into that routine, because routine I think is everything for just about anybody, especially people living with dementia.
Right. And it may need to be depending on their cognitive level, it may really need to be routine as far as, okay, we're going to back up to the toilet. We're going to, pull your pants
step by step.
It may, step by step, routine, same thing every time.
And that, so even just that simple act of backing up to the toilet and getting ready to pull your britches down, that routine, and that those cues could be physical cues.
Because some of that, we've done that all of our lives. Right. So some of that is more of a, you can recall that a little bit easier if you have a routine and you get some of that cueing, even if it's, maybe it's tactile cueing where you're kind of tugging on their pants. Now let's pull your britches down, and but just anything routine and cueing that you can help to kind of get that started and continue.
Something too I wanted to mention that reminded me. Again, we've got a video for that, Lakeland.
It's fantastic.
How to change a loved one's brief without taking off their pants and their shoes. So we've got a video for that. And so make sure you go out onto our YouTube channel. And if you want to link that in the show notes too, Lakeland, I think that would be helpful.
Absolutely. We will.
But, tearing the brief, because the briefs are terrible, tear to the side. It's easy to remove once you do that, but then learning how to feed that incontinence brief over the shoe, over the foot, up through the pant leg, around the crotch, down the neck, the other pant leg. I mean, it's kind of a weaving thing, but, with practice, even just that little do-it-yourself hack kind of thing could really be a game changer for people.
Yeah.
Oh, absolutely. Because taking off the shoes and the socks and the pants just kind of adds to that. And I know, not rushing an individual living with dementia through an activity, or anyone, that doesn't feel good either when it comes back to their dignity and respect. And so if you can find those little time savers, those little tricks, many of which I know are on your YouTube page, that can just be, again, a game changer and set everyone up for success for this very personal activity. These have been such wonderful tips. And I just want to encourage caregivers, if you're finding yourself frustrated, just try a few different things. Reach out for help and support. And also just know you're not alone. This is part of most everyone's caregiving journey at some point. And so it's not something to shy away from. It's something to lean into and find things that are going to help you along your journey. So, any final thoughts on this topic from both of you before we sign off for today?
I just want to reiterate what you just said, Lakeland. You're not in this alone. There are lots of resources that would love to help in anything that they can, because they know that it's not just yours. It's not just happening to you. It's happened to lots of other people. I would say probably, it's make sure that you're maintaining their dignity. Let them do as much of that they can.
Right.
So, but functional independence your independence doesn't look like what it looked like when you were 21, right?
Right.
You bed covers out and you hop out of bed and you just run to the bathroom. It's not like that anymore. So what are the things that you can do to set them up for success? Maybe it's just something as little as unsnapping a snap or unzipping the zipper, but still, that's something that they can participate in and help maintain their dignity.
That's right. That's right. And one of the things we didn't touch on, but I'm just going to say real quickly, setting them up for success, letting them do as much as they can. That may need to be, maybe they need a toilet riser and handles on the toilet.
Oh, yeah. We didn't even get to that part of the tips.
That's okay. But maybe the toilet's too short, just something that helps them feel comfortable and allows them to be as independent as possible.
We got video for that lately.
We do.
Of course you do. Of course. Well, and I think since we are mentioning a couple of those, like toilet seat risers, the handles, there's also the bedside commodes too,
absolutely.
which can be a game changer for so many because you don't have to go all the way to the restroom.
Right.
Or let's just throw in a few more tips here at the end, making sure that there's a well-lit path from the bed to the bath.
Huge.
That is so huge. So whether it's night lights or making sure that they can easily turn on the lights, that's also huge. Well, it doesn't have to do with a toileting product at all. It's a huge part of safety in preventing falls and any injury. And so, there's so many products out there, but as we talked about at the very beginning, it can be so overwhelming. And I think taking the time to kind of assess what's happening in your unique situation and doing a little bit of research, going to your YouTube page and seeing, what might be out there that could be beneficial. And, I think being okay with the fact that there's going to be some trial and error in this discovery process, but that's okay.
Yeah.
That's certainly
Absolutely.
okay.
Absolutely.
Well, thank you so much for both of you sharing your wisdom, your expertise, showing us the products, and for all the work you do to help caregivers just kind of find their way on their caregiving journey. It's been so great to reconnect with you both, and I just thank you so much for the work that you do.
We appreciate the opportunity to be on your show and to get to talk to your viewers. It's a subject that really we need to talk about more.
Absolutely. All right. Well, we'll have to have you back for another topic here soon.
All right.
Good.
Thank you.
Thank you again to Cindy and Christina for sharing such practical and compassionate advice today. Incontinence is a part of many caregiving journeys, but with the right tools and understanding, it doesn't have to feel overwhelming. To our listeners, remember, dignity and comfort go hand in hand. These everyday adjustments can make a big impact in your loved one's quality of life and your peace of mind. If you found this episode helpful, please subscribe, leave a review, and share it with someone who might benefit. You can always reach me at caregiverchats@homeinsteadinc.com. To learn more about home safety and caregiving tools, visit homeinstead.com/care-resources and follow us on social media at Home Instead Inc. Thanks for listening, and please remember to take good care of yourself while you care for others. Caregiver Chats is brought to you by Home Instead. If you're looking for in-home care to support you on your caregiving journey, please visit homeinstead.com to learn more.